Introduction. So my name is Cindy Rina Kerridge, and I lead our evaluation and strategy consultancy here at NCVA. And I am delighted to be joined here today by my colleague, Jenny Potkins, who is our strategy consultant. Pass away there, Jenny, thank you. Also pleased to welcome our two guests in today's webinar. So we have Joe Jenkins from the Children's Society and also Julian Gore-Booth from WFSA. So you will hear from both Joe and Julian later on today. And we also have Chanel Brooks on the call to help us produce this webinar. So thank you, Chanel, very much for all the work that you do in the background. So in terms of what we cover today, we will give you, first of all, kind of an overview of the strategy development process, what it involves, the different kind of key different steps. And then we talk through, or Jenny rather talks through the tools and some of the tools and approaches that can help you with deciding on which options to choose as part of your strategic development process. And then, which is really exciting, we hear from Joe and Julian kind of real life examples of how they use different tools and approaches to make those tricky decisions. And then towards the end, we have the questions answer session and also some further information about resources towards the end of today's webinar. So really pleased to be talking today about tools and approaches to help with your strategic decision making and prioritization. So just a kind of little bit of a recap, I mentioned at the beginning that this is third of our webinars as part of this, in this series. So in our first strategy webinar back in September last year, we started by providing you with an overview of the strategic development process. And then last month, the webinar we held then that focused on theory of change, especially how it can help with setting your strategic options and how it can also be used to help you monitor and evaluate impact and effectiveness of your strategy. So if you didn't attend these webinars, you can access recordings of both of the first two webinars on NCVO's YouTube channel. So there should be a link in the chat for that. So before I pass on to Jenny, I'm just going to go doing a very quick recap to provide you a brief overview of the strategy development process. So reason we do develop strategies is the fourfold really. So it will set direction and focus for your organization. And I think the other thing that is really, really important, it engages and enthuses your staff. So you share and you build this strategy together with your staff so that you all have that sense of direction and focus. So by going through this process, it allows you to identify risks that you can then plan for, and also, of course, opportunities that you can exploit. So this webinar, as you know, will be focusing on a couple of tools and approaches that can help you prioritize your work. So this is highlighted yellow on the slide here. So if you are about to start a new strategy process, it is sensible for you to review your environment at first, both internal environment and external environment, before you move into setting your strategic decision and prioritize your work. Although in practice, a lot of this work can happen in parallel. And once you have understanding of the environment you operate in, you're in a lot better position to set your strategic direction and identify what your organization stands for. That is, your mission, your vision, your goals, and so forth. And then the next step is then to identify your core competencies, the things that you're good at, and then prioritize the different initiatives that you will deliver and to work on. And in practice, you're likely to do a number of these mini cycles as part of this process. And then just a couple of other things to be mindful before you kind of start thinking about your next strategy or when you are developing it. I mentioned the staff at the beginning. So first of all, it is essential to clearly communicate that you are starting the process within your organization, and also identify resources you need to build a strategic plan. And by resources, I mean mainly, your time, because it does take some time to do this thinking and go through this process. So you will also need to identify a team or individuals who will be more involved and facilitate the process. And then you go and start organizing those meetings, or a meeting where everyone gets together and where you explain the overall strategy development process, talk through what outputs and processes are, and then start working on the content. And then just the final thing to say about this process is that some of this work you should do together, while other parts can be done individually or in smaller teams. So for example, you tend to have a small team or an individual, a dedicated person that pulls together information about your environment. And then you share this information more widely when you come together to set your strategic direction. Similarly, if you would do some of the evaluation and analysis work individually as kind of homework, and then you come together again to prioritize and do the final planning of your strategy. So that's kind of an overview of the different steps you take as part of the strategy development process. So I hope that was a useful introduction. So I'm going to hand over to my colleague, Jenny, who will be introducing a few approaches and tools that you can use to help you make those strategic decisions. Because, it is a hard thing to do, to decide on which one is the least important when everything is important. So over to you, Jenny.
Thanks very much, Sydney. So later on, Julian's going to talk about how dual bottom line analysis help the WFSA make some tricky decisions. So before that, I want to give you an overview of the tool. It's a particularly helpful one when you're presented with more options than you have resources to deliver, which is usually the case, or when you are facing a reduction in income and you can't do everything you used to. In 2019, NCVO started a major strategy development review. And when the pandemic hit, like many charities who rely on income generation, we found ourselves with a significant reduction in our financial flow. So our strategic decision-making changed quite rapidly from not only considering our role in the sector and for the organisations we work for, but also how we would be financially viable for the long term. And ultimately that required a major restructure and loss of some staff. So next slide, please. What is a dual bottom line analysis and how do you do it? Well, here's the most common dual bottom line analysis framework, where you map the activities you deliver according to their income generation or financial sustainability versus their social value or impact. Your mission doesn't actually need to go on the framework, but I've popped it here because it has to be at the heart of your decision making. And when I say activities here, I'm using this word in a really specific way to mean the things which you deliver which create social impact in the world. So these are, for example, the services you deliver to your beneficiaries, maybe products and the campaigning and advocacy that you undertake, not the kind of behind the scenes things. So in the top right quadrant is where things go which create high social value and also bring in funds for you. It's kind of a win-win situation, the things you want to sustain. The top left means high social value, but not generating income. You might be putting resources into those. And for NCVO, like very many charities, this is where an activity like campaigning would sit. Bottom right means low social value, but may bring in quite a lot of income. Something here may be a very useful activity, therefore, for supporting your high social value, but low or no income generation activities like campaigning. In the bottom left quadrant go the activities which don't create so much social value and which you may be putting your funds into, for example. These are the activities which in your decision making are most at risk from you stopping them. And then once you've mapped your activities, you have set the scene for decision making. Next slide, please. But just a word of caution, before you map, you need to consider a couple of things carefully. One is, what does value mean to our organisation? And make sure that people involved in the process are really clear about that. Is it about users? Is it about wider social value? Is it about the financial value that something brings to enable you to continue something else? So just making sure that you're not making assumptions about how people are putting things on the framework. And also be honest with yourself about whether you have good enough data to really understand how much value you are creating. Obviously, to use the framework, you'd have to make a good estimation, but it might throw up some gaps in your data, your monitoring and evaluation data. Next slide, please. The other thing is how much things really cost to run. And to do the analysis effectively, you should aim for mapping against full cost recovery. So this means not just thinking about who, for example, your staff are delivering the services, but thinking about all the things that go on around that, maybe the management time that goes into supervising that, the fundraising activities that bring in the income for you to run those services. So really thinking about all the costs involved. And this can be quite a challenge. You probably have to estimate it at some point rather than get into all the nitty-gritties. But it really shows up, again, where you have gaps in your understanding. Next slide, please, Cindy. So dual bottom line analysis is particularly useful because it makes you really think about the relevance of all your activities in relation to your mission and the resourcing that they require, really considering all of your activities rather than looking at some of your work in a more siloed way. Next slide, please, Cindy. And then when you've completed your mapping onto the framework, this provides the basis for thinking about what maybe you should stop, what you should change, maybe what you do differently or reduce, and what you are going to commit to continue. But in itself, this mapping won't give you the answers. Next slide, please. You need to test your thinking. And here I won't go through them, but some of the things that you might, questions you might ask to do that. You need to look at what is happening in your environment. Maybe you're duplicating work of other organizations, or maybe you're filling a gap, even if an activity is low impact. What would stopping it mean for your other activities? What difference would it make to them? Would you lose vital information? Or would it affect significant relationships, for example, with the council? So all kinds of things that you need to consider, as well as where things appear on the framework. Next slide, please, Cindy. Well, you may be thinking, we're small, we don't have that much income or many income streams. But if that's the case, it can still be a useful tool for you. However, instead of mapping income, it may be more helpful to map the resourcing required to deliver your activities against their value instead. It's good with all these tools to get different perspectives from people and have an open discussion. However, if you are in a situation where you need to lose some staff, or you think you may need to, you may be quite limited in the kind of people you can invite into that discussion. Next slide, please, Cindy. So soon we're going to hear from Jo as well, from the Children's Society, about how they've embedded even overstatements in their strategic decision making. So again, I want to give you an overview. Next slide, Cindy. We're always presented with more options than we can deliver. We may feel like we want to do everything, but we have limited resources. So that means we have to make trade-offs. Even overstatements are a way of making strategic choices or prioritizing. However, they are also a way of remembering what we are prioritizing. Strategy is not just about the big decisions of the plan. It has to be delivered on a day-to-day basis. And even overstatements are also a way for your staff on the ground to make decisions in line with your strategy. It's not about choosing something good versus something bad. It's about the trade-off. As we are often making decisions about one positive option over another. Not just and it's not just about the trade-off, but also making the strategic commitment. We do these kind of trade-offs in our day-to-day lives. I'm considering, should I get up at 4 o'clock on Maybank holiday morning to listen to the dawn chorus, even over having a well-deserved lie-in? I may swap that statement round and make a different decision there. But what would this look like for a charity? Next slide, Cindy. Well, here is an example of a small charity providing advice and guidance. In the face of extensive need, they have to make decisions in order to manage their resources effectively and to keep their staff workloads manageable. So they might need to make decisions about who. And they might make the decision to focus on existing service users, even over people who use the services, people who need the services, sorry. Thinking about what they might provide the services they think are most important, even over income generation from the local authority. Thinking about how they might decide to focus on tailored one-to-one support, even over widening the offer through general online content. So here, the even over statement is expressing that it can be quite a difficult choice, but that we really have to make it. Back to you, Simi.
Lovely. Thank you so much, Jenny. So you heard an introduction of those two different tools that we have focused on in this webinar. And then in a moment, Joe and Julian are going to tell us a little bit more about how they use those tools. So the first one was the dual bottom line analysis, DBLA, and Julian will be talking about that. And but first, Joe will be talking about the experience of using those even over statements. So just kind of mini introductions. So we're going to hear from Joe Jenkins, who is Executive Director of the Children's Society. And we worked with Joe and his team in 2020 to help with their strategy development. And as part of this work, used even over statements to help to frame those choices and agree priorities. So yeah, over to you, Joe.
Brilliant. Thanks, Cindy. Thanks, Jenny. And good afternoon. Really great to be with you all this afternoon and share some of our experience at the Children's Society over the last couple of years as we've been developing our strategy. And one of the key reflections we had when we embarked on developing a strategy was in the world we were operating in, and that was before a global pandemic hit us all sideways. We recognised that the world in which you would develop a 3-year or a 5-year fixed plan in which you made all of your choices year on year just wasn't going to be relevant to the world we were operating in. And so we knew that we'd have to treat strategy much more like a compass than a map. It would need to help us get a sense of direction of travel and enable us to be able to make judgments along the way to get to where we're trying to get to, but we wouldn't be able to kind of chart the path because we would have to be able to react to the world we're in. And even overstatements have been a really, really helpful tool for us in setting out what are some of the parameters we're working in and to equip our people to be able to make decisions on the front line where they need to in a way that's joined up with the overall strategy. And what's powerful about even overstatements is it's a tool that you can apply at many different levels. So you can do it at big strategy level, but you can also apply it tactically, and you can do it at different scales. So whether you're a massive international charity or a local organisation of 3 or 4 volunteers, there are ways you can make the same kind of choices that can equip you with the work that you need to do. So a little bit of context, the Children's Society, we're a national charity. We work with some of the most vulnerable children in our society, and we've been doing it for quite a while. We've been around about 140 years. We were founded back in 1881. And the way we work today involves a combination of direct work with young people in their communities, supporting children to turn around their circumstances, and then working with young people to bring their voices and their experiences to amplify them to change systems and society for future generations. So to campaign, create political change so that more children can benefit from their experience. And when we got to 2020, so we were coming up to about 140 years at that point, we decided to use that year as a milestone year to take stock of what we were learning from our work with young people. So we started with a big conversation that looked on what had we been learning from young people over the last decade, from our staff and supporters and partners and allies and critical friends and young people themselves, and use that to really understand what young people are experiencing today and what they would be facing in the decade ahead. And that led us to refresh our vision, to be really, really clear, what are we here for as a Children's Society? And we believe we're here to create a society that's built for all children, so every young person has the opportunity to thrive and be their best selves. And we set a goal for the decade. What's the single biggest ambitious thing we can harness all of our work to achieve towards that vision over the 10 years ahead of us? And we then developed from that a theory of change that said what would need to be true for that goal to be realised. And our goal over this decade is to overturn the damaging decline in children's wellbeing. So to reach those vulnerable children with the lowest wellbeing, and overall to see more young people with higher wellbeing by the end of the decade, following 15 years of year-on-year children's lives getting harder rather than easier. So it gave us some clarity and focus, but we needed to make sure that that kind of high-level strategy could be translated by our people and our partners to make sense of what it means around operational and tactical decision-making. And we found through the strategy process, where we got to that point of clarity around our ambition and focus, there were a few themes that kept emerging about what do we work on, who are we working with, how do we do that work, which tie us up in knots. Because as both Jenny and Cindy have talked about, like many charities, we try to do everything. And although our goal gives us a focus, it's also pretty audacious and ambitious, which means there are a lot of things that could all contribute towards its achievement. And so we needed to make a way of saying, for the Children's Society, where do we best focus our effort, our resources, and where we can have the greatest impact. And we felt if we can provide clarity up front, it'll free people up to then be able to get on with the work without needing to rehash and return to those same questions. So you can see the strategic choices that we arrived at to focus the Children's Society towards the goal. And just to say, to get to those choices, we drew out the themes that we were hearing all the way through that conversation with our stakeholders. And we framed them then as provocations. So a list of things which we challenged ourselves to say, is this really important? If we weren't to do this, would it allow us to do the things that would make the biggest difference? And then as a senior team, we then rag rated it. So red, amber, green, we looked at the things that we thought were important, but not necessarily useful for decisions, and we put those aside. We looked at things that we thought were important and useful, but not at the strategy level. So they might be particularly useful for a function or a particular area of our work, but not at the organisational level. And then the greens were those that we prioritised, and that led us to what we have here, which we tested with trustees, with managers, with stakeholders, and then we sharpened them to what we now use. And the choices you can see here, they represent some of the key things that we knew would come up time and time again in how we implemented the strategy. So who are we trying to reach? What kind of change are we trying to achieve? What will the role of young people be in achieving it? How will we work with others? And what will it mean for how we work internally? And what you can see described here are then within the statement of how we want to approach it, what the choice might need to be that we can apply. So the first, a focus on improving the well-being of the most disadvantaged children. And what that means as an even over is that we will work with the most disadvantaged, that's the children with the lowest well-being, facing the greatest inequalities and structural challenges, even over all children's well-being. So even though our goal is to overturn the long-term decline in children's well-being, our focus will always be on those who are most vulnerable. That will inform our funding choices, what projects we run, what campaigns we deliver, and that will be our first checklist on whether or not that's the thing we should most focus on. The second, in terms of the type of change, we'd recognise from our analysis that where we had greatest impact was when we were engaging with the systems around young people, as well as benefiting the children that we were working with directly. And so that meant that we would focus on systemic drivers, which means our even over is tackling the underlying patterns caused by low well-being, even over individual change for young people. Now, this is a really hard emotional choice for us because we run many, many projects and we do some really great work where the children who are involved in those projects have their lives changed. And we know it's really, really important work, and those children's well-being will be improved. But we need to focus on the projects that lead to greater systemic change, that change the way the care system or the criminal justice system or the education system work, which means we have to prioritise the work that can drive systemic change, even if it means putting aside or not investing in work that we know is good for children, because that's where we think we have greatest impact. And then the third choice was an internal challenge, because we have for 140 years valued the voices and needs of young people. It's in the DNA of the Children's Society. But what we said in the strategy moving forward is that we needed to make sure from governance, strategy to tactics, young people are at the heart of how decisions are made and their voices are influencing how we go about that, which means we need to empower young people even over status quo processes, systems and ways of working. For example, it would be fairly typical that we would say we'd really like a young person to be involved in this piece of research. But if the deadline meant that we couldn't get young people involved, we would prioritise the deadline. We need to get at the ball by this point, or we've only got this amount of budget. Whereas here we're saying, actually, the board meeting has to push back. The deadline needs to move. We need to reallocate resources because this research needs young people's voices in it, even over the convenience of our timelines, our processes, how we've worked in the past. Similarly, on partnership, we've always worked with others, but we've recognised that our goal is unachievable without generous collaboration, us putting collective impact even over our individual short-term interests, which again is challenging because it says we all collaborate to achieve impact even over the convenience of going it alone and even when it demands organisational sacrifice. That means partnering with others even if our brand has to take a back seat. It means partnering with others even if it would be quicker to get our own statement out than to get a statement with others. But again, we feel that if we start with impact, there will be times where we absolutely have to put that collective impact even over what might be in our individual interest. And then lastly, a crucial cultural point that we believe this strategy needs us to be more than the sum of our parts. We don't just need great individuals, great functions, great teams. We need everybody to be working together to achieve our collective impact. So a star organisation even over star teams. And when you put these things together, the way that we've started to implement those as a set of choices is that it now affects what projects we run, how we run them, what funding we seek, how we do fundraising, how we put bids and applications in, what campaigns we run, how our teams are being led, how we run our projects. The last 2 days we've spent setting personal objectives for people in the organisation, and we've used these choices to look at how you set objectives and what objectives we set. And as I said, the tool itself is now being widely used, not just the choices that we've made at a strategy level, but we also now use it at a project level. So for example, we just launched a new project and in the even over statement, we said quality is more important than time on this project. So here's what needs to be delivered within a year, but but in order to achieve the outcomes, it may need 15 months, it may need 18 months. So the choice will be the quality of the project rather than time. In other projects, it might be the budget can't stretch, so that will dictate the time and the quality and so on. So we use it tactically and operationally, but using it in the strategy has meant that we've hopefully set a compass that can guide people for how we will implement it. So that's me and the Children's Society's experience, and I think I'm handed on now to Julian.
Oh, thank you. Before Julian, just wanted to say thank you very much, Joe. Really fascinating to hear. I loved the way you talked about your strategy needing to be more of a compass rather than a map. I think that resonates with a lot of people at the moment. And I just wanted to remind everyone, please feel free any point, post your questions to the Q&A function, through the Q&A function, and we will have then about 15 minutes towards the end to ask those questions from the panelists. And also it'll be nice to hear from you as well in terms of, you know, what you say are the challenges that you are facing in terms of strategic decision making. So Chanel, you could post a question to the audience as well while we hear from Julian next to their take on strategic decision making. So let me just move on to the next slide. So you will be hearing from Julian Gore-Booth, and he is Chief Executive of WFSA, which is a global network of national societies that brings together qualified practitioners of this specialized area of medicine. I will let you, Julian, to talk through spell out your organization's name, because I will get it wrong. I complain being talking English as a second language, so I'm not going to attempt it. So Jenny facilitated a series of strategy workshops. It was like a couple of workshops for your board and staff in April last year. So this is based on that experience. So over to you, Julian.
Great, thank you, Cindy, and thank you, Joe, for that previous presentation. I was just thinking that, you know, even though we're very different organisations, a lot of the strategic choices that we're facing. Some of those choices you had also really chimed with me and our organisation, so there are similarities as well. So the WFSA is the World Federation of Societies of Anesthesiologists. Next slide, please. We are a global organisation, very much volunteer led and run. We have a small secretariat that happens to be in London. It could really be anywhere. And we cover most of the globe through this membership of national societies. But what we're trying to do is to make anaesthesia and therefore surgery safer and more accessible for the 5 billion people on our planet who do not have the access that some of us might take for granted. So that's what we're trying to do. Next slide, please. So you don't need to read the stuff on the left, but what we're trying to show with this slide is that the organisation went through a period of growth. We are a small charity. We grew from sort of $300,000, $400,000 to around 5 times that over a period of a few years. But the real message is just that there was a huge increase in activity. And of course, I'm sure, like many of you will be experiencing, no time to think. A constant pressure to do, a constant pressure to deliver, but no time to actually take a step back and think. And we had a very, very engaged leadership, but the leadership being, in this case, also clinicians themselves, also really, really pushing to just keep doing more. So that's where NCVO and Jenny came in. Next slide, please.
Sorry, just there is a message in chat, Julian. If you could adjust your microphone a little, be easy.
Is that better?
Yes, it's just it kept phasing off at times. Perfect. Thanks.
Okay, thanks. I hope you can hear me better now. So we got together with Jenny at NCVO, and this was the brief. We asked for support to facilitate a series of strategy workshops. And we wanted to look again at how we would fulfill a revised vision and mission. And then we looked at how we would commit resources and which projects we would stop. So basically it's coming back to this word prioritization. And I would say that this conversation and this process would apply equally to you, whether you're working locally or nationally or even internationally, and really to any size of organization. The tools or the things that we used was environmental analysis, theory of change, which many of you will be familiar with from previous workshops, I understand, and then dual bottom line analysis. So we'll just talk you through a bit of that. So next slide, please. Again, you don't need to read this slide. This was our straw theory of change. What I wanted to emphasize with this was just to say that if you go into these processes, you do have to do quite a lot of preparatory work. So the more that you're able to put into the process, the more you will get out of it. So as a team, both at the governance and management level, we were encouraged and we needed to engage with the process and exchange a lot of information and put in a lot of work with Jenny, even before we did the workshops. And that obviously added huge value to the workshops themselves, because then we were able to already have quite a lot of the work done, and we had a lot prepared and ready to talk about during the workshops themselves. Next slide, please. I don't know if like me, any of you are addicted to strategic conversations with Post-its. So I'm showing this slide because even if you do this kind of process online, there are amazing tools. This one's called Jamboard. There are amazing tools to really encourage inclusion and interaction and to get everybody involved from the organization. You can split up into different groups. and you can really behave even online in a way that you would if you were doing this face to face. So we found that experience incredibly useful, and also just really good fun. So getting to grips with that, and for me, as somebody who occasionally tries to run this kind of process myself, it was also very instructive. I learned a lot just from going through the process about how one might go about this and facilitating something similar. Next slide, please. Your Jamboard and your Post-its can come in different colors, and you can have as many groups as you like. So you can take your process through to various different levels of your theory of change, of your log frame, and it's extremely helpful. And then, of course, you've got everything saved and stored. So then, even better, you can refer back to it when you come to then putting together, perhaps more formal documents or references afterwards. Next slide, please. So this is just one of the examples that we put together of the DBLA, of the dual bottom line analysis. Again, you don't need to know what these different activities are, but I'll just refer to a couple of points on this. So what we did with this is we actually got different teams, or we split the staff, and this is just 10 staff, into 2 groups to look at this before the board did. And we split the 2 groups very broadly into one group who tend to think more about income generation, development, and one group who tend to think more about implementation and need. And I don't know about you, but quite often people working in those 2 different groups think about things in different ways, and think about the projects and activities of the organization in different ways. So you'll see that something like in the bottom left, it says book donations, gets thought about in different ways by different groups, and you end up with some kind of rationalization, which might put your activity somewhere in the middle of the 2 opinions. We also learned from this exercise that we needed to do much, much better at getting financial information about each activity stream or each project. And so one of the results of doing this analysis is that we have had to get better and have put a lot of effort into making sure that we are better at tracking individual projects so that we can actually better analyze their value using a tool like DBLA. So I'll come back to that. Next slide, please. Another really useful exercise that we did was we presented project concepts around potential future activity to the group in the workshop, and then got people to actually, online to rank where they would put those areas, and we came up with this ranking. And what that has allowed us to do also is to think very clearly around which areas we would develop more of a business case for and look at more closely, and which areas we wouldn't put that effort into. So it didn't decide completely, oh yes, number 1, we're definitely going to do the online anesthesia classroom. But what it did do is say, yes, okay, we are definitely going to put more effort into developing a business case for that option so that we can consider it more seriously. Next slide, please. So what did this all mean, and did this have any impact on the organization? I think it absolutely did. And in the next slide, I'll just explain some of the things that we've done with this, or some of the decision making that has happened since. So in terms of strategy development, we used the revised theory of change. So we built another one. And that has to inform the development of our broader strategy, looking all the way through to 2030. And as mentioned, we've definitely improved our financial monitoring by project. And we're now adding that into our overall DBLA. So we're returning to the tool and using it again repeatedly, and keep coming back to it. And I think that's very useful. On cost saving, we've changed our focus on production of like paper publications. So some of those we've stopped, so we've been able to actually stop some of our activities. And we've also put more rigorous criteria in place for our fellowships program activity and educational activity post-COVID. And we'll probably not go back to the same size of program because it was using up a lot of unrestricted reserves and not bringing in very much restricted income at all. So we were able to reconsider that. And then on number 3, we set aside significant free reserves for that project, the online anaesthesia classroom. So we put together a business case for that project, and we've now set aside free reserves for that because we think that will be not only, we think that project has, we know it will appear very high on meeting need, but we also need it to appear over on the right-hand side of the DBLA. In other words, it needs to bring in money as well. But we're prepared to beforehand. And we've established a mentoring program and are increasing staff capacity on an area that we previously probably ignored, which was, or did not done enough, which was member society strengthening. Next slide, please. So all of that together also enabled us to create this. These are my terrible graphics, but forgive me for those. But it enabled us to create a revised overall strategy and to keep returning to the tools that we had been introduced to through the process, and we're still using them now. That's it. Thank you very much. Thanks, Jenny.
Lovely. Thank you so much, Julian. I mean, it was really fascinating to hear the whole journey that you took together and using the DBLA as part of that kind of the wider strategic development process as well. And it was quite nice to see as well the buzz on digital tools that you can use to bring people together and brainstorm. So I think our next webinar needs to be on Jamboard and Miro and pros and cons. So just very briefly, I'm handing over to Jenny for a few more tools and approaches that are available, and you know, if you come to our training, you will learn more about them, but we just whisk through them now before starting with questions and answers. So you have just a minute more to post your question to the question and answer chat. Thank you.
Thanks, Cindy. So next slide, please. So many of you may have a SWOT or know about SWOT analysis. This is a great tool for decision making. The important thing is to make sure that you keep it strategic, and rather than just making a long list, really do that extra bit of thinking to think, what are the most important things that will make a difference to our organisation, thinking about the internal and the external. And as well as using it through your strategic planning processes, it's something you should bring in regularly into your thinking, for example, at your board meetings to keep your strategic decision making live. Next one, Cindy. So a strategy screen, excuse me, is a bit like saying, ask really important questions. I mean, literally what you're trying to do is think of a screening process about these options against criteria which are most important to your organisation and strategy. So here I put some of the questions that you might put there. You don't need lots of questions, you just need to get the right ones for your organisation. And, you know, particularly useful when there are a lot of ideas, a lot of enthusiasm about them, getting people into that reality space. Particularly helpful are questions like, how can we implement this and maintain our existing services? And what further knowledge do we need for decision making? Next one, Cindy. And the last one is called force field analysis. So the idea here, whether you're trying to reach a strategic goal or whether you're considering a change in your organisation, is you identify the forces which are both pushing you towards it and restraining them. If you're trying to reach a goal, by identifying those, you can mitigate against the negative ones and try and strengthen the positive ones. If you're trying to make a decision, then it helps you focus your minds rather than talk around the issue. So there's a few more tools, and I just want to just let you know what's at the end of the deck. So Cindy, just whiz through 2 slides, please. If you want to learn more about tools, you can view our previous strategy webinars Cindy's mentioned. You can come to some of our training sessions, and we've got a new one starting in June, Navigating Strategic Risk and Change in the Voluntary Sector. And then 2 more slides, I think, Cindy?
Just one more to say thank you, but and find out more.
Yeah, I just wanted to signpost to know-how. There's information about our support and services team and our know-how pages, and we'll be revising the strategy pages on those over the next few months. So in a couple of months, come back and have a look at the support you can get through those.
Brilliant. Thank you so much, Jenny. And just a reminder as well, you will be getting this slide deck after today's webinar, so you can access those links that way as well. So thank you all the panelists. It's been really fascinating to hear, all these different tools and approaches that you can use to help your decision making, because as was said, both Julie and Joe, it is hard when you want to do everything and want to be ambitious, and then you have those difficult decisions to make. What is it that you will deprioritize? So I can see there are been a few questions in the that have come through. So if you are happy, I will start asking those. So there is one question about the timeline. What is the timeline from starting and finishing this process? So Joe, would you like to start with that?
Yeah, sure. And I guess the kind of context is both that, in a sense, that there isn't a set timing that is necessary to undertake an approach like this, and in a sense it will depend on your context and the level of engagement and stakeholders that you would like to and need to involve as part of that. And I should also say, when we were developing the strategy at the Children's Society, it was in 2020, against the backdrop of the first year of the pandemic. So there were quite a few other things that meant we had to make some judgments around the kind of pacing and how we involve people and so on. But the short answer is our strategy went from January to December. So it was kind of in a few chunked phases. So our first bit was the kind of listening exercise, the big conversation that we had with all of our stakeholders, looking back at what we'd learned and looking forward at where we felt our ambition should be. And that led us to development of our vision, ambition, where we thought we could make the biggest difference. And we took that to a May board meeting. And with agreement on that, over the next few months, we developed our strategy framework. And so by December, we then had agreed on the overarching framework, the even overstatements within it, and high-level strategic objectives. And we'd also looked at our brand and our story as well. That was a process that meant we were involving lots of stakeholders all the way through. So at each of those stages, we were going out to staff, out to volunteers, we were speaking with young people, we were speaking to critical friends. That takes more time. So you don't need to do all of that. And if you don't, then it will be quicker. But there's huge amount of value. And I would say, in a sense, we've been able to go quicker in implementing it by going slower in involving people, because we've had a lot more buy-in, which has meant people recognise what we're trying to deliver, and then they've been able to go on the journey. And so I would advise, take the time up front to get it right, because you'll go quicker once you implement it. But if you have to, by necessity, move faster, these tools can be used quite quickly. You could do even overstatements in a workshop in an afternoon with a set of key senior leaders in the room, or a trustee board meeting.
Great, thank you. Thank you very much, Joe. Julian, would you be able to also kind of tell a little bit about the timeline and starting and finishing, from start to finish, and also what kind of time commitment did the whole process take in altogether? And sorry, I didn't mention this earlier. Julian needs to leave a little bit early, so yeah. So let's ask the question while he's still here. Over to you, Julian.
Thanks, Cindy. Yeah, forgive me, I have to drop out a couple of minutes. It depends how you view this, because I was really thinking about what Joe was saying about stakeholders, and that will change the depth and time on the process so much. But the actual sort of exercise, if you like, if you boil it down to that, for us was a series of preparatory meetings, some between myself and Jenny, just to sort of set the scene and for Jenny to understand the environment, which was very important. And some governance getting involved in that, board members getting involved in that as well is very important as a minimum to get some environmental understanding. The actual workshops we did in 3 half days, I think it was, Jenny, and we managed to get quite a lot into those 3 half days. That then generated, that in itself, they did generate quite a lot of work, because there's no point in doing the 3 half days of workshop if you're not prepared to follow up on it. So I would suggest that, you know, it's difficult to put a number on that, but 3 half days of workshops and some preparatory meetings were the core that set us on our way.
Great, thank you.
Could I just come in there, Cindy, just to say something, because when we did those workshops, Julian hadn't had enough time with his team to really do that analysis on the sort of full cost and things like that. And this is a bit what happened at NCVO. We kind of put a finger in the air and said, oh, we think this goes here on the framework. But then actually it brought up lots of questions in those workshops. And then obviously you have more time to test your thinking and put things on there. So even if you can't get all your ducks in a row before your workshops, it's still a really valuable process.
Great, thank you. Thanks very much, Jenny. I think we have time to squeeze in one more question, and then after that, there is going to be just a quick poll as well, because, you know, we of course also need to know how useful these webinars have been, and, you know, what you enjoyed it and what would you like to hear more of. But before the poll, just wanted to ask another question. So there is kind of one question about how can you make good decisions when you can't afford an external facilitator. So perhaps that's for you, Jenny.
Well, obviously it helps if you have an external facilitator, but you know, I think the most important thing is to understand the different strategic tools that are available for you, because most organisations, you know, can't afford a facilitator to do the extensive work that we do with organisations like the Children's Society. So, I mean, you can attend NCVO training, things like that, things like this webinar will give you some starting information, and just seek to build up your knowledge and think about what are the most important tools to use with our organisation at this point in time. And that's a conversation you should be having with other people in the organisation as well. And I think another really important thing is thinking about the skills you have. Do you have the right skill set on the board to support you with these processes, to help you at that strategic level, rather than maybe thinking at an operational level? So it definitely can be done. It's a bit harder to be in a meeting and facilitate it, but you can definitely do it. Yeah, you just need to build up your knowledge.
Great, thank you very much, Jenny. So perhaps if you could pop in the poll now, Channel. So we have a feedback poll. And I'm just going to read it through as well, because I know that in the recording you might not necessarily see the question. So the question is about satisfaction, how satisfied you are with this event. And there are options between very satisfied and very dissatisfied, 5 options. And then there is the second question that follows up on that, the question about would you recommend an NCVO event to others? So thank you very much for taking part on today's webinar and responding to the poll. I think that those are the questions we've had today. So I mean, those were the areas we wanted to cover today. So if there are no more questions, I think we have, it is a wrap really. We have completed today's webinar, and I can gift you a minute and a half back, and hope to see you here again in the future NCVO webinars. So thank you very much, everyone, and we will follow up with the email, and it was lovely to welcome you here, and enjoy the rest of your afternoon. Thank you. Bye.